Utah Politics.
Thanks so much for joining us. I'm Glenn Mills. It is time to go inside Utah politics. We do begin this morning with Mo Hickey. He is with Voices for Utah Children, here to discuss the biggest needs ahead of the legislative session. Mo, great to have you on the show. Thanks so much for being here.
Thanks for having me.
A very important topic. Let's start off with kind of an overall view of how kids are faring here in the state of Utah.
Overall, I would say we're doing okay. We're at Voices right now, we're actually looking into the most recent numbers, which have been delayed, with the census numbers being delayed last year. But overall, I would say we're doing a little better in certain areas than others, but it's been improving.
Okay. Also struggling in certain areas, and we'll dig into those a little bit as we get into the top priorities. But let's start off with optional enhanced kindergarten. That's something you're going to be advocating for this year on Utah's Capitol Hill. Talk about the possibilities and what's on the table there.
Yeah, we're excited about the opportunity. There was funding placed last year during the session, and we're hopeful that we'll be getting increased funding again this year. It's supported by USBA, UEA, the state school board has made it a priority. So what we're looking for this time is to get an actual funding package for the next 3 years, so that every year we don't have to keep coming back and having the discussion. It's an area where we've gotten huge community support, if nothing else during the pandemic. Areas like child care and early child care and early child education have been exposed as having needs, and we feel that OEK is one of those areas.
Talk about who's running that bill and your conversations with that representative.
Steve Waldrop will be running the bill, Representative Waldrop, and I think it's really going to turn out being a bipartisan solution. Representative Larry Snow had been a lead champion on this in the past, and he's handed it off to Representative Waldrop. But it's something that I think is bipartisan in nature, and we've had really good support the past couple of years, and we're very optimistic that we can move forward on this.
And talk about the need. How can optional enhanced kindergarten help a child get a strong foundation for the rest of their educational career?
Well, there's the educational component, which is that it's been proven that early childhood intervention on education has a long-term benefit for the child in a number of fashions, both in terms of lack of need for remediation, coming in on grade level in first grade, addressing the needs of the child at that crucial age. In addition to that, what we've seen is a lot of our programs prior to OEK being established were half-day programs, which really started making it very difficult for the families. If you had to drop a child off, come back and pick them up. So for working families, it was a real challenge. We focused on the optional piece because we do understand that there are families that want their child to stay at home until they start first grade. So this is trying to find that proper balance so that their child is the centerpiece of this, and getting the support that they need so that they can move into their educational path at grade level.
Yeah, we've talked a lot about how crucial it is to build that foundation early and how that can sustain a child throughout their education. Let's move on to healthcare coverage, another important issue here in the state of Utah, and you're pushing for 100% kids coverage. Talk about what's being done at the Capitol this legislative session to hopefully make that happen.
So again, Utah right now is 46th in the country in child care coverage based on population, and we know we can improve that number. One of the biggest challenges is access to systems that are currently available for the child. So just like we were talking about early child education, the health of the child in those early years is so important. So if we can make sure that every child in the state has access to insurance, that they can get the services they need, it really sets the stage for a thriving childhood and beyond. So, you know, Utah was we were the state that founded CHIP. So between CHIP and Medicaid, a vast majority of the 82,000 children that currently do not have insurance would be able to access some form of insurance. So it's a combination of outreach and accessibility to online platforms to sign up, and make sure that the children are getting the services that they are eligible for.
Yeah, so we're talking in many instances, as you just mentioned, the children are already eligible, they're just not taking advantage of what is available to them.
Right, and you know, there are barriers, there are structural barriers, there are simple things like more than half of the population of uninsured children live in rural districts, so the question is there Wi-Fi access for parents to sign up? How can they sign up? You know, there was a talk of doing community outreach at some places like Department of Workforce Services offices, which could be helpful in certain places, but if you have to drive 45 minutes in a rural county to get to the DWS office, to actually sign up, and you don't have access to Wi-Fi. So we want to make sure that we remove as many barriers as possible and find some common sense solutions to make sure that the children have access to the services that they're eligible for.
Okay, another top priority your organization is watching for this legislative session, community health workers. What do you mean by that, and what's the connection to children in this case?
Well, one of the things we found out during the pandemic is that our public health system is lacking in a number of areas. And one of those areas is actually meeting people where they are. So in a lot of our both rural and low-income communities, we don't have hospitals in certain places. We don't have offices that are open on a regular basis. So having community health workers that work with the families across all ages within the family to make sure that they're monitoring their child's health, their behavior, bringing services forward to them, letting them know what services they're eligible for. So the community health worker really covers a lot of vast areas within the family, but it's something that we've found has worked well in other places. It's worked well in places in Utah where it is in place, but we don't have enough currently in the state of Utah.
Yeah. One last topic. It's one that's on your agenda every year, it seems, and we're talking tax policy both at the state and federal level. What are you looking at this year?
Well, this is one where we're looking at really a parallel track. On the federal level, we're keeping a close eye on current legislation that has been delayed, and that could have a really serious impact on a lot of areas that affect children in Utah. So there could be funding for childcare, there could be funding for pre-K expansion. We don't know what the timing of that's going to be, but it would affect some of the discussions that are taking place regarding things like childcare in this current legislative session. So we're watching that in a very positive way. On the other side, there have already been 2 bills filed in Utah, one to cut the state income tax from 4.95 to 4.90, and yesterday there was a bill filed to reduce the corporate tax from 4.95 to 4.6. The combined reduction there would be over $100 million on an annual basis at a time when we have a list of unmet needs in the state, not just for children, which are certainly the area we focus in, but you know, we've seen it coming up recently with the homeless population, food insecurity, mental health situations, et cetera. So we strongly this year believe that this is not the right time to be cutting taxes and cutting those necessary services.
All right, we will watch how that all plays out. We of course know the governor would like to see a food tax credit in there as well, so we'll see how that plays out. Mo, very important conversation. Thanks so much for being here and sharing your thoughts this morning.
Thanks for having me.
You bet. Still to come.